So I hope everybody is staying safe, staying busy. I know for sure all of you are staying busy. And we are excited to be able to support you and your students in this crazy time. I am not far from thinking that education may be changed forever, or at least significantly modified. And we're excited to be able to share some of these things that we've been working on over the last few years that I hope will make your learning for your students easier, deeper, and that some of the work that you would have to do as faculty, that we have done the heavy lifting for you. I would also say that at any time, if you have comments, chats, please feel free to chat in, and I will stop along the way and take questions, and we can discuss this as we go. All right, so without further ado, this is our deep dive series. So I like to slow down a little bit and take you through some of the apps that we have. Just this morning, we got the approval to bring together a new NeuroRehab app that I'm going to show you, take you through a deep dive in. And also Dr. Eydie Kendall and Dr. Brian Cleveley, we're putting together a virtual reality pediatric gait analysis app. So I think all of these things you'll see little pieces of, and I think I hope you'll be excited about being able to utilize this in your classroom. So just briefly, to introduce myself, I'm an associate professor at Azusa Pacific University. We're in Los Angeles, near Los Angeles. I've been here at APU for 17 years. I'm a teaching and learning fellow. I did my specialty training in Kaiser, orthopedic residency and manual therapy fellowship. I currently teach for the residencies as well as for the USC Spine Fellowship, where we use these apps. And I've spent the last 6-7 years dreaming about how technology could change the way we educate. There were problems that I just could not solve, and there were problems that me and my colleagues at APU could not solve, and we decided that this was the time to see if technology could change that. So also at the university, I chair the IRB. So this is, I always have a lot of little things going on in the background. So here I want to just introduce a couple of the app authors. We're primarily talking about the apps that we have available today, and then I'll give you some sneak peeks as to ones that are coming in the next few weeks. So this is Kathy Kumagai. Kathy, do you want to just mention a little bit about yourself and your background?
Sure. I am a full professor at Azusa Pacific, and I've been there a little bit less than Mike. I want to say probably 14 years now, I think. And I was until this year the primary neuro instructor, all those years for the neuropathophys and neuro rehab content. In life, you know how you kind of go with what you know. So when I had an amazing person for neuro rehab. So I started my career in inpatient neuro rehab and did the head injury, spinal cord injury, stroke thing, progressed to outpatient. And then when I got to outpatient, I wasn't so good at managing the orthopedic thing. So then I thought, well, maybe I should go learn that. And that led to the orthopedic residency. And now I'm clinical faculty for the spine fellowship and sports fellowship at Kaiser. So the first half of my career is really all hardcore inpatient neuro. And the second half has been mostly ortho. And then my job in these fellowships has kind of been to teach ortho people how to look at patients like neuro people do. And the last thing I did, and it's finally over, but I found out if that keeps on giving, we just published the CPG for concussion. But I found out that as soon as you're done with that, you're supposed to start the revisions because some of it's outdated. So, but anyway, so that's my life. And I get to hang out with Mike Wong, who has all these crazy ideas and makes these things that you never thought were imaginable possible. So this is what you get when you have somebody who is a little bit ADD, but it works immensely to our benefit.
Wonderful. Thank you, Kathy. So yes, Kathy and I are two peas in a pod. I one day went up to her and I said, Kathy, I think we can build an app for ortho. I've got this logic thing built in. She's like, yeah, but that's not exactly how we look at life in neuro. I'm like, wait, what? So how do you guys look at life in neuro? And she's like we look at life this way and that way. I'm like, Well, how am I going to build an app for that? So I'm excited to share different ways that different professors are coming together to create content that will change the way we teach neuro. I hope will enhance the way we teach neuro, and that this product, this tool, can continue to evolve. That is why we built it into a web app, which all of you should have access to. Also, I didn't want to miss a chance to talk about Rachel. So Rachel is currently at City of Hope working with her patients. She did her residency through USC Rancho Los Amigos. She was the mentor for the neuro residency at Casa Colina, right near our university. In 2015, she got the Academy of Neurology Early Career Award, and she is now the director of oncology residency at City of Hope. So Kathy and I, we looked at each other and said, we can think of no better person to do the NeuroExam app than Rachel. And you will see that she has done an amazing job putting together a collection of tests and measures that you can use in your classroom. So also, I just want to mention that PhysioU has now partnered with JOSPT. We are in the business of trying to implement guidelines to help guidelines come to life. The concussion guidelines is on the list. Filming videos for that guideline. We have videos for every single clinical practice guideline from JOSPT. So this is another area where we are trying to work very hard to bring evidence and make it more easy to implement in the clinic. So I want to share with you 4 ways to use PhysioU apps in your online classroom, especially related to the neuro content and to the pediatric content. So first, we're going to take a quick dive into the NeuroExam app. So Kathy, I was going to ask you to share a little bit about, you can think back 2 or 3 years ago when we first started this project. Why did you feel the need to build this app? And you're going to have to unmute yourself, Kathy.
Can you hear me?
Yep, now. Yep.
Okay. You know, the biggest challenge, I think for anybody who teaches this content, the biggest questions that the students always have are when do I use which test? Like, especially when it comes to balance. So, you know, we teach them like 25 different balance tests, and then trying to help them figure out which one would be the best one to use for each population is the part that I think takes the most time. So what this app has done is it's cut that time in half, because now when we demonstrate the test, we don't have to go over all the little details of explaining the mechanics of the test. So what I usually do is, if we're going to go over balance in class, I'll tell the students, okay, for lab tomorrow, we're going to do the tug, we're going to do the DGI, and we're going to do BERT. So your job at home before you come to class is to review those tests. If you want to, run through the mechanics, practice on somebody, but at least get the mechanics of the test down. And then when we come to lab, we still do a demonstration so they can see somebody actually do it, even though it's filmed quite well in the app. But this is where you can now have the discussion about what patient you would use this for, who it's appropriate for, like what do you look for, like how would you decide what test to do with which person. The discussion becomes more about the clinical application, not so much about the actual mechanics of the test. And so, you know, the students only retain like so much information at one time anyway. So if they can get the details of the mechanics of the test down first, then that allows us to not have to talk about that so much. So this has been a game changer for us. And then the biggest thing on the back end, because not everybody remembers everything, they can refer back to the videos. So I have 1 million less questions, which means half the questions I used to have, because I still get 1 million, on like, where do you stand? Where do you put your hand? Was this the one where you have to do this? What's the norms? So all of those types of questions, they can just refer back to the video. So really, they don't have any questions about how to do the test. Their questions are more about the decision making on how do you interpret the test with complicating factors, or, you know, which test do you do? So that's perfect. What's made this huge. It has totally changed efficiency of lab, and then the much richer conversation we have around the clinical cases.
Yeah, I remember, Kathy, when we talked about this a few years back, you brought out this 5-inch binder full of black and white pictures of
Yeah,
all the
yeah, yeah.
tests
That's the
that
other
you're going to
picture.
have to go through. So we knew that there was a better way to teach the students, and we thought, why don't we just film them all and organize them nicely? So what I'm going to do is take us into the app real quick. So I'm going to take us in just so we can get a quick look at it. So what I want you to see here is that all of you faculty have full access. We want you to be able to utilize this already in your classroom. So I'm going to sign in here from PhysioU.com. And what you see is a series of apps. And here is the NeuroExam app. So all of these categories, we believe, help the students to access and store information better. So if you look at balance, guys, this week for balance, you have a bunch of balance tests on your lab handouts. And I'm going to show you all how to link all of these videos into your lab handouts to make it easy for you to run your online class, as well as have the students preview these videos. So you can see all of these different tests, 5 times sit to stand. There's Rachel.
With your arms folded across your chest, stand up and sit down as quickly as you can 5 times. Your timer will start when you say go, and your timer will stop at the top of the 5th stand. Are you ready? Set, go. 1, 2, 3.
So you can see that the students can actually watch and learn and try these on each other, on a family member. This is what we are recommending for our students now that we moved everything online, because it helps them grasp the idea and come up with more questions to make our synchronous online sessions more meaningful. So you have the purpose, the setup, patient position and therapist position, the cues, as well as the normative values and cutoff scores for fall risk, right? And then everything is cited here. So you can see that there's a number of different balance tests, probably pretty much all that you'll need. We had the Neuro Toolbox in mind to provide a video resource to support that. She was teaching in the neuro residency at the time. And you can see then we have motor control, coordination, and all the different diagnosis-specific tests. Fuglemeyer, Stream, Asia, Asia Motor, Asia Sensory, and your vestibular content, cranial nerves, peripheral signs. So we have back here cranial nerves. So you can imagine that this particular app in and of itself should cover pretty much everything that you're going to need to teach them in entry level for the examination component. I'll show you the intervention component next. So let me just stop for a second here. Does anyone have any comments, questions, or things that they want me to show them within this app? James, if you want to unmute yourself. Yep.
Unmute. Yeah, I think I'm unmuted. Can you hear me, Michael?
Yeah, I can hear you.
Yeah. Okay. The other question is, the videos kind of a little freezing up or whatever. If everyone would really close their videos, their little picture thing up there, I think that helps out. And then also languages that this has been translated into, just real quick.
Yes.
Is the only question so far.
I would say that we are busy right now translating the bulk of the buttons in the app into Portuguese, Japanese, Chinese, and Spanish. So this is our focus on trying to deliver this tool to the worldwide faculty and students, because we know that everyone is being affected equally by this coronavirus period of time. So you can see then that there is pretty much everything you're going to need to teach this in your online classroom. and I'll make a suggestion for how I think you should do it. It's how we've been doing it. I'm going to take you back into the PowerPoint. So here, I want to mention how easy it can be to augment your lab handouts with high definition video. So all faculty have full access. You can utilize this in your classroom. You can pull this up anytime you want because we think it will help students learn better. So what you see is your typical neuro lab. This is the balance lab. You have a number of different techniques that you want the students to learn. The hard part is being able to show them and pre-expose them to these techniques. So what we can do is go to the PhysioU Educator free resources. From here, you can go to the master video cheat sheet. And what you'll see now is a master list of all the videos that you can use to augment your classroom. So if you go to the NeuroExam here, you know that Romberg is one of the key techniques that you need. So you'll type in Control F or Command F, Romberg, and there it is. You have the different techniques that you want. You can copy the technique, put it back into your document here. And usually what I do is I click on the app. It takes me to, this is exactly what your students will see. They can preview these videos. I usually like to grab a screenshot just to make my lab trigger a memory on how to do these techniques, how to do these tests. So I will add that right here. So from here, you can grab the screenshot, add it right in, and now you have a completely playable lab. You can also take this and just hyperlink the image. So now when your students click on the image, it will take them directly to the video. You can do that with all the different tests here. So technically, with this particular setup, and let me take you there one more time because I know a lot of people will find that to be very useful. So here, if you go to PhysioU.com, there is an Educator tab. Under Free Resources, you will see a master video cheat sheet. So we just reorganized this because we knew a lot of people were having problems finding it. Once you click on that, it will take you here. So you can see every single one of our apps: CardioPulm, Range of Motion Manual Muscle Test, Gait, Lines and Tubes, Assistive Devices, transfers, assistive devices. Every app is now sorted here so that you can find Modified Ashworth, all your tests here, right? Oculomotor, here's the oculomotor exam, all your vestibular tests, all here. And all you have to do now is cut and paste these in. So the question that a lot of faculty have been asking is, does that mean that my students need to have a subscription? Technically, yes, because that's how we pay patients. That's how we build all of this. But because of COVID-19, we basically decided that we were going to give access to all students in the world for free. So they will have full access all the way through August 15, which we just extended to August 15. We even thought we would be back in class in June. And this is our attempt to try to minimize the disruption and support faculty as they move their classes online. So all the videos that you need are here. You can see all the faculty here adding links into their lab handouts. So my suggestion for how you do this is what we just did for our clinical skills range of motion manual muscle test class. So it is valuable, just like Kathy had mentioned, to give the students a call to action. This week, you have balance techniques, balance tests that we're going to learn. I need you to go through your lab handout, click on the videos, and watch them on your own. And then I want you to try it, visualize it in your mind, try it on somebody, because it will help you develop questions. It will take what you saw on the screen into action. Then when you finally get to your online synchronous session, it is as simple as pulling up your lab handout again, clicking on the links, watching the videos together, and then adding your clinical expertise, creating situations, scenarios in which these tests and techniques would be useful, creating a situation where the student would now have to modify the test or perhaps choose another test. So this is where I think the videos can really make a big difference. Imagine if all we had was a bunch of videos and they never really tried it, and we waited until fall or December to do the boot camp, and we need to show them everything all at once. I think for deeper learning, it is much better to pre-expose, have them try it, have them watch it again, and talk them through it more. So think about the number of exposures that is happening. And actually, a lot of that work they've done on their own. It is really just a call to action. The other thing that we found quite successful, this is what we were doing in our face-to-face class, it's what we're doing in our online sessions, is we are using our third years, so our senior students, so the hand-picked, chosen few. They know that the students have to sign up to do virtual checkoffs every week. So there will be a list of different techniques based on the techniques that they learn for that week that they will have to jump onto a Zoom meeting, and they will basically go through the skills checkoff list, talk about it, talk about what type of patients it should be used for, try to describe it or demonstrate it if possible. We did this for range of motion, MMT, palpation. It was very successful in helping us get them to the final practical, where we did a same online Zoom, and we also asked them the same 4 things. Please demonstrate these same 4 things. I think we're going to have to rethink in the next few months, how are we going to manage the skills and the skills checkoffs as well as the exams. It may be a temporary solution, but we're going to have to come up with one way or the other. And so we found that it to be quite successful here with the virtual checkoffs.
Dr. Wong,
yes,
real quick, and you kind of addressed it already, and that is the questions were how to get this into lab manuals or lab handouts, and you showed that, but also comment on the learning management systems.
Yes.
Stuff like that,
so we are working on making this easily accessible through the learning management system. Most universities are using this independent. So yes, you can cut any of these links and put them into your LMS. That's not an issue, because when the students click on it, it will open a new tab and they will be able to see the videos once they're logged in. So I think there should be no issue with you taking any of those techniques from that master cheat sheet and augmenting your lab handouts or augmenting your LMS courses. Okay, so that is the NeuroExam component. So the NeuroExam component, Kathy and I have been talking and dreaming about. Now we need to get to the interventions. And then Dr. Sarah Kraft out of MUSC came along. So PhysioU and MUSC, Medical University of South Carolina, is now partnering to bring you the NeuroRehabilitation app that just this morning we got the code for, that we would now be able to link it so all PhysioU users would be able to access this. So let me take you there now. Let me give you a glimpse of what that looks like. So I'm going to click into this. So here you can see that what Sarah does is she has done a full evaluation, a full exam. So in the early parts of her neurorehab class, she actually has the students watch the full exam and take this little quiz. The quiz cues them in to different things that are important in these different short little videos. So all of this is asynchronous. The students are just being shown the big picture, and they are interacting with this little quiz, and when they choose the right answer or the wrong answer, it will basically tell you. So they will learn one way or the other. They will learn.
Hey, hi Malika, I'm Sarah. I'm going to be your physical therapist today, and I wanted to ask you a couple questions before we get started.
So here you can see, here's the wrong answer. Yep, here's the right answer. So no matter what happens, the students are going to learn as they go through this quiz. So they're watching the evaluation, the history. We can watch gait observation with no shoes or no brace. There's also a quiz related to that. All right. You can see that there is also tone and spasticity assessment, functional mobility observations, transfers, unlevel transfers, objective outcome measures. So imagine the big picture, how powerful that is. So before you start your neuro rehab component, the students have been able to see all of these pieces come together and have taken a little quiz. So they can begin to build this picture of who they are supposed to be and what they are supposed to do with all the skills that they're going to learn for the rest of the semester. Now, the other part that's useful is the intervention side. So you can see that Sarah has carefully organized all the common interventions. All of it is being, much of it has been closed captioned. We are working on that at PhysioU as well to improve accessibility. So these are all videos. And you can see now that that goes to hypotonia, weakness, spasticity and rigidity, transitional movements, standing gait, step up. All of these different types of common interventions are now here available for you if you need it, so that you can actually demonstrate, show these techniques, talk about it, give the students context about when to use it, at least the heavy lifting of having all of these videos organized and filmed has been done. And so this, I'm hoping, will be available within the next couple of weeks. This is a big project. We've been working on this over a year, and we are now very close to being able to release that. Let me see if there's, the other thing that I think is really useful, that Sarah and I had talked about this a couple weeks ago. Here are case studies. Real patients, Parkinson's, TBI, stroke, spinal cord, and then wheelchair. And there are cases that she has written up. So we are working with the programmers to provide cases with questions, and the questions also have the answers hidden, so that you can take the students into using these different videos. They can go out into breakout rooms and discuss the case, discuss certain key questions that are coming up built into the case. So we are reorganizing this so that it will be very easy for you to run your classroom and develop clinical reasoning. So you can imagine the value of having a resource that has so many different types of patients. Any questions so far? Okay. So
one quick one, Mike. Are the videos going to be translated also when the translations occur?
Yes. So
okay.
This is a very expensive and challenging thing, but yes, we are working on closed captioning as well as translating all the content into the different languages. It's a mammoth task, but we are committed to doing it. We've already started testing the closed captioning mechanism. We're rebuilding the entire app so that we can do translation and closed captioning. So, yes.
Now the MUSC stuff is going to be in the PhysioU app, not like a separate thing you have to link to, is it?
We haven't decided yet. You will get to it through here. You will get to it through here. So there will be a new button here to get to Neuro Rehab. And once you click that, we haven't decided whether it will play within this or whether it will open in a new tab. That's temporary until we get the new system up and running.
Yeah.
But it will be through PhysioU. It will be very easy for faculty to just log into one place. That's the goal, is faculty will have almost everything they need for a PT curriculum. They can just log into one place.
Got it.
Okay, great.
Thank you.
Sure. So that is a glimpse of what what's coming through here. All right, so I'm going to move on here to talk about learning and interacting using the Developmental Milestones app. I would say one other thing related to neuro. Actually, this will come in the sneak peeks towards the end, some of the apps that we have coming up very soon. But in neuro, I'm going to take you there right now. For Peds, that is, we released Developmental Milestones. This took us a year to film because for the motor milestones, we followed the same baby through month 1 to month 12. It's the same baby. Month 0, we didn't get to him early enough, but you can see that our instructor who just used it this past semester, would use this to watch the baby in different positions, talk about observations that she's looking for, atypical development, switching to the different positions. So of course, these are all videos that you can talk through. And then she would move from month to month. So she'd say, hey, look at how this baby has changed, how their supported sitting looks, how he can hold his head up in midline. So this will be a very useful resource, I think, so that you don't, I'm sure many of the faculty have their own videos. We just want to create a place where a good set of videos could be utilized and the students can access it whenever they need it. You can also see reflexes. So we filmed all the same reflexes, all the common reflexes. What the stimulus is, what the response is, when it appears, and when it integrates. So again, we're not trying to rewrite the book. We're trying to augment the classroom with tools that will help the students to learn. We also created a reference for standardized testing. Now, of course, all of this testing is proprietary, so we have tried our best to create a way to help students make meaning by diagnosis, for example. Here are the common tests that you would use for this diagnosis. And when you click into it, there's some basic information, and it can link you to where to get it. However the faculty are doing this, I think is up to them. So that is the Pediatric app, as well as I think we added one other component. You can sort the diagnostic or the standardized testing by age. And we have created some basic case studies for your students to try. So they can do the aims. They can observe the baby. They've been given a call to action. Here's the task, the link to the instrument, and then here are the scores so that you can talk about it after they've gone into their Zoom meeting and scored this together with their group. So we have bot 2, bilateral coordination, along with just a brief overview and the key. So of course this is hidden until you open it, and then DAISY 2. So we'll continue to grow this. But we wanted to give the students now an opportunity to not just take it in, but also to utilize. So this is what Melissa uses in her class. She just used it this past semester. Any comments about the Pediatrics app?
Michael, there are just some people who apparently have had access to it or played with it, but they just love it. They say, and at the CSM, I think that's where we were.
Yeah.
Where we're at CSM? Yeah, in Denver. And a couple Peach folks combined just were amazed at the Peach thing. So, but anyone else want to unmute and comment?
Yeah, and I was just going to say that we have a new part that we're going to be releasing. So we filmed a lot of different babies. Some have developmental delay. Some are developing normally. We will add that in here so that you will be able to pull up different videos of different children and analyze them together with the students. So it's just a work in progress. We already have filmed a lot of it. We are now just working on the observations, the answers, so to speak, that will be hidden. So that's a new update that will come. That is why it's a subscription model, because this work is endless. And your valuable input allows us to continue to evolve the tool to match the needs of your learners and your particular teaching needs. Okay, so let me move on here to a sneak peek at some of the exciting stuff that's coming. So here, Dr. Eydie Kendall, who's part of the team here. Eydie, do you want to actually just mention a little bit about why you came up with this?
Sure. Yeah. So the idea started when I shifted back over from clinical practice into academia, and I wanted to have actually, first of all, the idea was to have a virtual case, and then we got to the point where we realized that having a whole entire case and doing a whole exam, evaluation, treatment would be very, very difficult. So we focused in on gait assessment and observational gait assessment, because that's so important for our pediatric clientele. And what ended up happening is we captured a bunch of motion data using a Vicon system, and I sent that over to Brian, my partner in virtual technology and design, and he built characters around those gait patterns. And then we sort of created this kind of a edutainment virtual reality game for gait assessment. And right now we're using the Edinburgh visual gait scales for the game. And so you get to watch a pediatric patient. You get to go through each line item and assess them, and then at the end, see how your scores compare to the answer key.
I would say that Eydie and I met at ELC a couple years back, and when somehow we reconnected, and she said, "Hey, I've got to show you something." And the moment I saw it, I thought, man, that is incredible. So some of these, of course, are real patients. Some of these are just actors who mimic the common different kinds of conditions. But what we've done purposefully is to protect the identity of the patient, yet create an environment where we could simplify the process of movement analysis and actually use a validated scale and allow students to go through step by step. So what you saw was us taking what they had originally built and preparing it for the use in the classroom. So Brian added the posture chart, the goniometer. We added this component here, which is all the steps of the Edinburgh Visual Gait Score. When the students are done, so we tested this out in our classroom because we were beta testing it and getting feedback. So right now, Brian, Eydie, and I are going back and forth, cleaning it up, getting it ready for you to use in your classroom. So the students can you could do this all together, and then you can send them off, and I'm going to actually take you here. I'm going to take you into it real quick. And what you can see then is that you can choose a different type of patient. You can move the view, and we purposely made it simple to circle around to observe their movement. And while you're going through it, you can then begin to score them. Initial contact. Okay.
I would add too, one of the best parts is you could stop it. So you could stop it right at initial contact and get a closer look than you could like with an actual patient that you're observing. So
That's super cool. And that's how this gait speed meter works. And so now You can say, hey, heal contact, moving on. And the students can then get feedback at the end. So Eydie just sent over a key. Hey, this is for the first patient. This is the key. The students will eventually compare to one another and then compare to the key and go back and fine-tune their analysis. I think of this as a stepping stone. This is how we can train students in a very simplified way to systematically analyze movement. I hope that this is just the beginning of a new way of thinking when we analyze even more common functional movements. Those are some of the apps that I'll show you in a second. So awesome work, Eydie. I'm excited to get this out there soon for everybody. All right, so let me move to, I'm going to stop this here. I'm going to move back. So this is almost done. We are probably, I'm hoping, by July or before July, available for you to utilize.
Dr. Wong, I'm going to interrupt for a second real quick. There's a question real quick because some people may have to step off for classes, but this will be recorded, yes?
Yes, this will be recorded. It will be on our PhysioU YouTube channel under the playlist Deep Dive. And we will be sending this to all the participants anyway for you to share it.
Upper extremity,
here's the PNF app.
abduction, external rotation.
So Amy is one of the clinicians, and I believe she's part of the faculty also at Kaiser Vallejo.
You need to wind him up and begin him in extension, abduction, internal rotation. His hand is around his greater trochanter, not too far away from his body.
So the PNF app has been a long process. It includes the principles of PNF. It includes functional application of PNF and all the PNF techniques that you're going to be teaching. So this, we just went through, double-checked all the videos, all the content, and we are now organizing it and getting it ready for the programmers for release, hopefully by fall of 2020. So all of these different pieces are coming very soon. This app alone has taken us over 2 to 3 years to build. Here's neurologic movement dysfunction. So Kathy and I have been talking about, wouldn't it be nice if we captured a bunch of videos of all of our patient day patients and had them do a bunch of different functional movements so that the instructors can analyze that with their students? So we have actually several of these patients that we've had them don and doff clothing, sit to stand, scooting, forward scooting, lateral scooting, pelvic tilting. We have a lot of that. It's just really organizing it in a way that would become useful for the faculty. So this is something that we are working on. And so this is just a brief overview then of some of this. So here's your pediatric virtual Gait clinic, your pediatrics developmental milestones app. Here is your functional movement app, probably your neurologic movement dysfunction, a lot of different patients with a lot of different functional movements. We've also, of course, filmed a person who's completely normal with no neurologic dysfunction so that you could compare side by side how this person with a spinal cord injury moves compared to someone who doesn't have any particular injury. So this is a work in progress here. We've captured a lot of that video. You have your NeuroExam app, NeuroRehab app. I'm dreaming of a neuroanatomy app that we hope will be able to get to you, and then the PNF app also coming. So both of these, the NeuroRehab app, I'm hoping within the next couple of weeks. The PNF app, I'm hoping by July, and then this, or actually I think I said September, and then here, this virtual gait analysis app, I'm hoping within also the next month. We are very close. I know Brian's working hard at it, and Eydie as well. So I want to just take a moment to open it up for comments or questions. Oh, let me make one other quick point. We have provided access for all faculty and all students through August 15, sorry. That means that there is no barrier for your students and for you to start utilizing this because time is tight. Everybody is up against a wall. So we said, you know what, let's make it available to everybody. And if you find it valuable, for one, in order to get access for your students, someone in your faculty probably has already signed up here at PhysioU.com coronavirus. We need to know how many codes to issue for your students. When August 15 is done and you have decided, hey, this is useful for us, it is extremely affordable for the students to use this. So I just want to, because this is a question that comes up often, I think, James. So I just want to show you that what many programs are doing is the students either come here, so it's $162 for 4 years. This is like $3 and something cents a month. Here's a 2+1. So this is, we always think about the program and the first year out. We know how critical having these types of resources with them is for the first year. So this is what it costs for the students, $162, the price of one textbook for 4 years, and all the updates, all the new apps, all of it just becomes part of what they log into. Many programs are just building this into their lab fee so that the students don't have to pay for it. They get to use their financial aid for it. So a program could easily reach out to us and say, hey, I have 80 incoming students. I would like to make sure that they have this because they can utilize it for everything from range of motion manual muscle test, assistive devices, lines and tubes, cardiopulmonary rehab, gait analysis, special tests, orthopedics. I mean, we have so many things, and we probably in the next week, we are ahead of schedule. We are about to release our Modalities Physical Agents app. Again, it usually takes at least a year. Because of the great need, we decided to push it forward and provide this resource for all universities so that the students could now learn how to set it up.
First, prepare the traction table.
They could watch it in high speed so you could narrate over it. They could look at images for the instructions. All your contraindications and precautions are here. How to set it up. Patient education, which is basically what we will send home to the patient, but also our students will learn to read every single one of these so that they know how to describe what this modality is, what it should feel like, how do I do this at home, how often should I do this, when should I avoid this type of treatment, when to reach out to your therapist. And there's always a case study here for you to utilize in your online classroom. So I just want to share that because it is coming out probably within the next week. We are right now vetting it with a number of faculty to make sure it is prepared and ready for you to utilize. I would just say that we are in this for the long haul. We have many new apps that we are working on, and we're excited to hear your feedback because we continue to make changes all the time. So you can always reach out to me at mike@physiou.com with comments. If you see something that's not quite right, we're constantly making changes. There is no such thing as, do you have the right edition? This is always the right edition. This is my vision for education and the resources for students for the future. So let me just open it up for comments and questions.
The comment, Mike, real quick, on the cost thing or whatever, and I know that at the ELC we were at in, I think, Jacksonville or Orlando, one of the two, a couple programs were using it. They did not have to require a couple textbooks for students. The other thing about this app is that you continually update it. I mean, I'd buy an edition of McGee Orthopedic Physical Assessment, and when a new edition comes out, I don't get set the new edition. I have to buy it again.
Right.
Where the subscription rate, as you update it throughout the subscription period, all the new apps, they get it with it. So I think it's a great value in terms of that. There's a question about, is there a price differentiation between OT, PT, PTA?
No,
Yeah.
I mean, we are building a whole slew of apps also for the OTs. We have a lot of our apps currently are being used in some of the OT schools, and so the price difference, there is no price differentiation, because essentially the same bulk of apps are going to be delivered to the different groups, and it's really, if you think about it, $3.50 a month for 4 years it's we really actually are very sensitive to the debt burden that the students have, and yet we still need to pay programmers who charge us $150 an hour. So if you think about what that cost, the cost to develop is, to pay patients, it really, the cost is very minimal.
You want to mention how you've worked with bookstores and things like that, where students can buy it like a book and use financial aid?
Yes. So we also work closely with the bookstores. If that is how your university wants to do it, again, all you have to do is reach out to us at care@PhysioU.com. So care@PhysioU.com, and mention that we would like to set up a purchase for the students through our bookstore, and we have people who will help work with your bookstore to take care of it.
I'll remind everyone that this is being recorded, so those who have to jump off to another meeting,
Right.
you won't miss anything because you'll get a recording here at the end here. One real quick question: do you sleep, Mike?
I sleep quite a bit, but I'm an early bird. So I am a 5 a.m. kind of guy. If I'm not out running early in the morning, I am building and dreaming and connecting with faculty. My dream really is rethinking how we can run classes with this new technology. I mean, we're building simulations. We're building simulations for neuro, cardiopulm, and peds that will help students make decisions. So it's not just a one-way flow of content. It actually is going to be, hey, here's your stroke patient. Let's look at how this person moves. Now, what do you see about the way they move, and what kind of intervention would you like to do to improve that movement? Just think about what that means in terms of the development of the clinical reasoning. It goes so far beyond the delivery of skills. And so we are building it. We have 50 simulations already built for physical agents, or 15 for physical agents, 50 for orthopedics, and we are designing and filming for cardiopulm and neuro and pediatrics as well. I mean, I've got a lot of stuff floating around in my brain, and what is even more exciting really is being able to work with you, to hear your feedback. We hope to be your tool. We hope to evolve this so that eventually it will be so easy to help the students become the therapists that we promised we would help them become.
Michael, I just gave you the link to the COVID-19 and posted the paragraph on what Kathy said about
Perfect.
labs, just so you know.
Yeah, I saw that. Thank you so much, Stacy.
You're welcome.
Thank you, Tammy, for mentioning that. Our ortho and neuro faculty use this app. And the Kines professor did a fellowship with me, so great. That's wonderful. And Karen's talking about using it in peds as well. So yes, I would invite you. Here's my I guess some closing thoughts. It is useful for you to go into the app, to log in. So I'm going to remind you how to do that. So you go to PhysioU.com and you sign in. Once you sign in, your login should have been already sent to you, and your password. Once you log in, I think it's useful for you to dig a little into what is available, because you can't really use it unless you know what's there. In terms of vetting it, rest assured, Rachel is pretty sharp. Both Kathy and Rachel, of course, have looked through the app. We've had this app out for at least 2 or 3 years now. And so when there's little minor changes, we just go into the green room and we film it. We update it. It is valuable for you to open the app up on a regular basis while you're in your Zoom meetings to show the students where you find things. to watch things with them, to give them context related to the content. The more you do this, and the more you have a defined call to action. So what I mean by how are we going to take a motor skills based profession and do that online? I think we're going to have to rethink how we teach, and we can leverage new tools to help expose students in a very formal, in a very organized manner, to expose them to the techniques, to help them learn these techniques, to leverage our student helpers, right? To leverage our student helpers to create an environment where they are getting some feedback. And maybe it will be a format such that we do the virtual checkoffs online, they're familiar with the techniques, and then for periods of time, much like the hybrid learning model, we bring them in to these synchronous immersions where they go over a lot more of these techniques in more detail. Think about the number of times you can expose them to these techniques. I think it can be done. I know the students were very successful with their range of motion MMT class that we just had final exams for them a couple weeks ago. So I hope that this is useful for you. We will continue to release updates to you as faculty about the new apps as they're being released. And you know that NeuroRehab, I'm hoping, will be out in a couple of weeks, more likely a month as programmer life goes. And then Pediatric Gait Virtual Clinic also, I'm hoping, within a month, but likely more like July 2020. Eydie, myself, and Brian still have some work to do based on the way that we want to present it to you. I hope that this session is useful for you. It will be posted on our PhysioU.com, PhysioU YouTube site under the Deep Dive playlist. So I hope this is useful, and I'm happy to stay around. Kathy is available, Eydie's around as well. If there's any other comments, if you have ideas or things that you think would really impact learning, please feel free to reach out to me. I'd love to connect with you and dream a little.